there are two types of insulin regimens that we give. One is called as the basal regime. You give one shot of insulin which works for almost 24 hours. And then you have another mealtime insulin which is called as the bolus insulin. You give this before breakfast, before lunch, before dinner. And then in the night you can give this long-acting insulin. So this is called as a multiple daily dose regime or a basal bolus therapy.
So supposing the patient is going to undergo a major procedure and patient is brought in after maybe a road traffic accident with a fracture and is sick, not really eating and has bled a lot, and sick patients. So in these patients, best thing is to start what is called an insulin infusion protocol. So an insulin infusion protocol means giving short-acting insulin in an infusion pump as shown here.
A 45-year-old gentleman, a bit on the plump side, slightly obese, and he has had diabetes for 10 years. So it's long-standing diabetes. He has also had uncontrolled diabetes for the past 4 years. He's not been in very good shape. And he has albuminuria as well. So these red flags already pop up in our minds. Long-standing diabetes, long-standing uncontrolled diabetes, albuminuria. That means microvascular complication. Perhaps it also means macrovascular complication. So what is going on in this patient's body?
And in our hospitals, we used to have a checklist so that we won't be missing anything, which includes, I will say, the 7 parameters. And this is as per the Association of Diabetes Care and Education Specialists from the US, ADCES, the 7 self-care behaviors. Healthy coping once diagnosed with diabetes, eating, being physically active, adhering to the multiple medications advised by the diabetes care team, monitoring all the parameters at home, reducing or I would say averting the risk of complications, and the ability to solve the problems.
ABC approach. What is ABC approach? A for A1C control, that is your glycemic control. B is for blood pressure control, and C is for cholesterol control. So these are the 3 which are the very important thing which we should not forget while dealing with diabetic patients, and then we should also approach these patients for annual screening for these complications.
So 63-year-old diabetic female, doctor by profession, a very strong family history of MI, and she is completely asymptomatic. So this is her investigations. She is a bit obese. She has diabetes, HbA1c is 8.1. She has dyslipidemia, so yeah, total cholesterol is increased, HDL low, LDL high, triglycerides high. Ultrasound shows fatty liver. So she's a fairly high risk case. So elderly, obese, diabetic, dyslipidemic female with a very strong family history. So all of us can agree that she has multiple risk factors for atherosclerotic cardiovascular disease.
So the question, he asked a second question, said, I find it difficult to walk in the morning. Will it be okay if I walk after a meal? Should it always be early morning walk in empty stomach? So we have grown used to this idea that walking is best in the early morning. It might be, but there is plenty of evidence to suggest that walking after food definitely helps. So I'll show you a few trials data regarding this.